Welcome to an exciting exploration of cardiovascular care. Hello, amazing colleagues, respected faculty, and aspiring nursing leaders. It is with great enthusiasm that we welcome you to this in-depth exploration of a transformative role in modern contemporary healthcare. Our session, entitled Cardiac Clinical Nurses Specialist, Elevating Cardiovascular Care through Advanced Practice and Leadership, promises to be an exhilarating journey. Let the heart-pounding adventure begin. As we gather here, we recognize that cardiovascular disease remains one of the leading causes of death worldwide, and the demand for highly skilled professionals who can deliver expert, evidence-based cardiac care has never been greater. Today's session, we will explore how the Cardiac CNS stands at the intersection of clinical excellence, leadership, and innovation. This role is not just about mastering advanced cardiac care, it's about transforming systems, mentoring teams, and improving patient outcomes through research and evidence-based practice. Throughout this lecture, we will journey through four key areas. First, we'll define the specialty and understand the patient populations and settings where cardiac CNS make the greatest impact. Second, we'll examine the educational and training pathways that prepare nurses for this advanced role. Third, we'll discuss the Advanced Practice Nurse Scope under the Philippine Nursing Act, a landmark legislation that empowers nurses to practice at the highest level of their profession. Finally, we'll reflect on why this field urgently needs APN, not only to meet the growing demands of cardiac care, but to lead the transformation of healthcare delivery itself. As we begin, I invite you to think about how the cardiac CNS role represents the future of nursing. A future where nurses are not only caregivers, but also leaders, innovators, and advocates for cardiovascular health. Let us now begin our exploration of cardiac clinical nurses specialists, a role that truly embodies the heart and science of advanced nursing practice. Cardiac clinical nurses specialist is an advanced practice nurse who provides expert care to patients with cardiovascular diseases. This role combines advanced clinical knowledge, leadership, research, and education to improve patient outcomes and strengthen the healthcare systems. The Cardiac CNS acts as a bridge between bedside nursing and medical practice, ensuring that evidence-based interventions are implemented effectively in all cardiac settings. What will be the next step for us to be a cardiac CNS? A cardiac CNS is a master's or doctoral prepared nurse who specializes in the prevention, diagnosis, and management of cardiovascular conditions. Their practice extends beyond direct patient care to include consultation, education, and system-level improvements. They are recognized as clinical experts who influence practice standards, mentor staff, and lead quality improvement initiatives in cardiac care. The future starts now. Moving forward, let's see what are the typical patient demographic for a CCNS. Cardiac CNS care for a wide range of patients, from those with acute cardiac events such as myocardial infarction, arrhythmias, or cardiac arrest, to those with chronic cardiovascular diseases like heart failure, hypertension, or coronary artery disease. The patient population often includes adults or older adults, though Pediatric cardiac CNS may also specialize in congenital heart conditions. These patients frequently present with complex comorbidities requiring advanced assessment and management. In clinical settings, cardiac CNS practice across multiple healthcare environments. In acute care settings such as cardiac intensive care units, coronary care units, and post-cardiac surgery wards. In these areas, the CNS provides expert consultation, assists in managing unstable patients, and ensures adherence to evidence-based protocols. In outpatient and community settings, these are heart failure clinics, cardiac rehabilitation centers, and telehealth programs. The CNS coordinates long-term management, monitors medication adherence, and educates patients on lifestyle modifications. In academic and research settings such as universities, professional organizations, and research institutions, the CNS contributes to curriculum development, clinical research, and policy formulation to advance cardiac nursing practice. The cardiac nurse role is therefore multifaceted, combining clinical expertise, leadership, and advocacy to improve cardiovascular health outcomes across the continuum of care.
Another key aspect here is all about education and training path for cardiac CNS. Becoming a cardiac clinical nurse specialist requires a structured educational pathway that builds advanced clinical competence and theoretical knowledge. What will be the educational requirements to become a cardiac CNS? First, you must have a Bachelor of Science in Nursing, which is BSN. This foundational degree provides essential nursing knowledge, clinical skills, and professional competencies required for entry-level practice. It includes coursework in anatomy, physiology, pharmacology, and basic cardiac care. After that, a Master of Science in Nursing, which is MSN, or Doctor of Nursing Practice, DNP, as a continuing education for advance in your profession. The CNS must complete graduate level education focusing on advanced health assessment, pathophysiology, pharmacotherapeutics, and evidence-based practice. Specialized courses in cardiovascular nursing, hemodynamics monitoring, and advanced diagnostic are essential. Then, you must undergo clinical practicum for completion and a written exam if it is required to be a certified cardiac CNS. So, graduate program requires 500 to 1,000 supervised clinical hours in advanced practice nursing. These hours are spent in cardiac units, interventional cardiology labs, and cardiac rehabilitation centers under the supervision of cardiologists or experienced APNs. Then what's next? Of course, you have to get training of certification that is always up to date. Some certifications are: one is Basic Life Support, which is BLS, which is the foundational certificate for all nurses. Two, Advanced Cardiac Life Support, which is ACLS, requires for managing cardiac emergencies such as arrhythmias and cardiac arrest. Three, Progressive Care Certificate Nurse, PCCN, focuses on care for accurate ill adult patients in step-down or telemetry units. Fourth, Clinical Care Registered Nurse, CCRN, recognizes expertise in caring for clinically critical ill patients in an intensive care unit. And fifth is Cardiac Vascular Nursing Certification, CBBC, offered by professional nursing organizations to validate specialized cardiac knowledge. For training environments, cardiac CCNS gain experience in diverse clinical settings. First is cardiac intensive care units, cardiac ICU, managing patients with acute coronary syndromes, post-cardiac surgery, recovery, and mechanical circulatory support. Second, interventional cardiology units, observing and assisting in cardiac catheterization, angioplasty, and electrophysiology procedures. Third is cardiac rehabilitation program, guiding patients through recovery, exercise, and lifestyle modification after cardiac events. And fourth, outpatient clinics, managing chronic cardiac conditions, medication titration, and patient education. This combination of education, certification, and clinical experience ensures that the cardiac CNS develops the advanced competencies necessary for independent and collaborative practice.
Now, let's shift our focus to the APN role House Bill 9389 or Senate Bill 1447. The Philippine Nursing Act, House Bill 839 or Senate Bill 1447, formally recognizes the advanced practice nurse as a nurse with advanced clinical expertise, capable of autonomous and collaborative practice. This legislation defines the APN's expanded scope of practice, including prescriptive authority, specialized procedures, and independent clinical decision making. Let's explore the scope of advanced practice. Number 1. Prescriptive authority. Under House Bill 9389 or Senate Bill 1447, APNs are authorized to prescribe medications, including cardiovascular drugs such as antihypertensives, anticoagulants, and antiarrhythmics within their scope of practice. This authority enhances continuity of care and reduces delays in treatment. Number 2. Specialized procedures. Cardiac CNS perform advanced clinical procedures such as comprehensive cardiac assessments and interpretation of ECGs, hemodynamic monitoring and titration of vasoactive medications, management of cardiac devices such as pacemakers and defibrillators, coordination of cardiac rehabilitation and secondary prevention programs. These procedures require advanced knowledge of cardiovascular physiology and pharmacology, ensuring safe and effective patient management. Number 3. Independent practice. The law supports APNs in providing independent clinical decision making, particularly in areas where access to physicians may be limited. Cardiac CNS can assess, diagnose, and manage patients autonomously while collaborating with cardiologists and other healthcare professionals as needed. Number 4. Consultative and educational roles. Beyond direct care, the cardiac CNS serves as a consultant to healthcare teams, guiding evidence-based practice and policy development. They also educate staff, patients, and families on cardiac health, prevention, and disease management. This legislative framework empowers the cardiac CNS to function as a leader in cardiovascular care, ensuring that patients receive timely, expert, and holistic management. A crucial part of this is all about the justification. Why this field needs an APN. Cardiovascular disease remains the leading cause of death globally and in the Philippines, accounting for a significant portion of hospital admissions and healthcare costs. The complexity of cardiac care requires advanced clinical expertise, rapid decision-making, and evidence-based interventions, skills that are central to the APN role. Let's take a closer look at the number 1, bridging care gaps. Cardiac CNS ensure seamless transition between acute care and community settings. They coordinate discharge planning, follow-up care and patient education, reducing hospital readmissions, and improving long-term outcomes. Number 2, expert clinical leadership. As clinical leaders, cardiac CNS implement evidence-based guidelines, mentor staff,
and lead quality improvements initiatives. Their expertise ensures that cardiac care units maintain high standards of safety and efficiency. Number 3. Patient education and empowerment. Cardiac CNS play a vital role in educating patients and families about disease management, medication adherence, and lifestyle modification. Empowered patients are more likely to engage in self-care, leading to better outcomes and reduced complications. Number 4. Research and innovations. Cardiac CNS contribute to research on cardiovascular nursing interventions, heart failure management, and post-MI rehabilitation. They translate research findings into clinical practice, driving innovation and improving patient outcomes. Number 5. System efficiency and cost effectiveness. By managing complex cases and supporting multidisciplinary teams, cardiac CNS help optimize healthcare resources. Their interventions reduce unnecessary hospitalization, shorten lengths of stay, and improve overall system efficiency. Number 6. Addressing workforce shortages. In regions with limited access to cardiologists, cardiac CNS fill critical gaps by providing advanced cardiac care, ensuring that patients receive timely and appropriate interventions. Collectively, this brings us that the cardiac clinical nurse specialist is a cornerstone of modern cardiovascular care. Through advanced education, clinical expertise, and legislative support, the CNS enhances patient outcomes, strengthens healthcare systems, and leads innovation in cardiac nursing. As healthcare continues to evolve, the integration of APNs in cardiology is not just beneficial, it is essential for the future of patient centered, evidence based cardiovascular care. So, distinguished colleagues and fellow nursing professionals, as we conclude today's lecture in the Cardiac Clinical Nurse Specialist or CNS, let us take a moment to appreciate the depth and significance of this advanced nursing role. Let us reflect on what this role truly represents: a synthesis of advanced clinical expertise, compassionate leadership, and evidence based innovation. The cardiac CNS is not simply a nurse with advanced knowledge. They are architects of change in healthcare. They stand at the intersection of science and service, translating evidence into practice, guiding teams through complexity, and shaping the future of cardiovascular care. A professional who blends clinical mastery, scientific inquiry, and compassionate leadership to transform patient outcome and elevate healthcare standards. Throughout our discussion, we have seen how the CNS role extends far beyond the bedside. It is a role defined by expertise, autonomy, and influence, one that bridges the gap between evidence and practice, between policy and patient care. We would like also to share some key takeaways. The first one is the cardiac clinical nurse specialist or CNS integrates clinical expertise, research, and leadership to manage complex cardiovascular conditions across all care settings. Second, the pathway to become a CNS demands rigorous education, specialized certification, and extensive clinical immersion. Third, the Philippine Nursing Act or HB 9389 or SB 1447 empowers APNs with perspective, authority, and independent practice, elevating nursing to a true advanced profession. Fourth, the growing burden of cardiovascular disease calls for advanced practitioners who can lead, innovate, and ensure continuity of care. Lastly, the Cardiac CNS is a catalyst for transformation, improving patient outcomes, advanced research, and mentoring the next generation of nurses. In essence, the cardiac clinical nurse specialist embodies the future of nursing. A future where nurses are not only caregivers, but also strategic leaders, innovators, and advocates for cardiovascular health. As we move forward, may this lecture inspire you to view advanced practice not merely as a professional achievement, but as a commitment to excellence and service, a promise to lead with knowledge, compassion, and integrity in every heartbeat you touch. Let us remember that the heart of advanced practice nursing lies not only in knowledge, but in purpose. Every advanced practice nurse carries the potential to transform healthcare, to turn evidence into excellence, and to ensure that every patient heart beats stronger because of the care we provide. Thank you for your attention, your passion for learning, your dedication to nursing profession, and your unwavering commitment to advancing the art and cardiovascular health. Together, we continue to shape a future where the journey toward becoming a cardiac clinical nurse specialist is not merely a career path, it is a commitment to excellence and a calling to lead, one that truly makes a difference in every life we touch. Thank you and have a nice day.